Hi there, Mark Jabin here, Medical Director for Haywood County Health Department. Let's talk about where we are now in this respiratory viral season. So, vaccine recommendations, and at the end, there will be an easy to follow picture of all the vaccine recommendations in both English and Spanish. Well, the confusion over COVID vaccines is now over. The acting CDC director finally signed off on the ACIP recommendations, and the good news is that it's now very simple. COVID vaccines are recommended for everyone over the age of 6 months, period. That's it. Which means the CDC ended up following the facts and the research, going beyond what Secretary Kennedy said, even beyond what professional medical societies advised, beyond the vaccine skeptics, even those now on the ACIP. Insurance companies, at least through 2026, and the federal government have committed to covering the cost. Medicare, Medicaid, CHIP, Vaccine for Children's Fund. If you have no coverage, the health department does have funds to cover the cost until this funding runs out. The only requirement for vaccination is that your decision requires what is called shared decision making, or as the CDC now puts it, individual-based decision making, something that any healthcare professional can do with you, doctor, nurse, pharmacist. No need for a prescription from your doctor. That's it. So, how should you navigate this individual-based decision making? This is an age-old medical practice, judging benefits against risks and determining a course of action. And of course, you do this every day. But in a specialized area like healthcare, consulting someone with knowledge and experience is helpful to put this in your context. I mean, there's a lot to be learned on YouTube, but is fixing your leaky faucet really in the same category as your health? So, what's the risk if you should catch COVID? ACIP says that the higher your risk, the more you should consider getting vaccinated. So who is at the highest risk? Well, those with conditions on the CDC list, and as many as 50 to 75% of Americans have health conditions on this list. Most notably, older folks, those immunocompromised, kids too young to have ever gotten infected or vaccinated. These are the groups most likely to get ill enough to need hospitalization, but they are not the only ones who get that ill. So are you one of these people? If so, you are at that higher risk that the ACIP recommends you get vaccinated. Second, even if you're not on this list, do you spend time with someone who is at home, at their home, at school, at work, at gatherings? If so, should you get COVID, what risk do you pose for them? And I'm pretty sure no one wants to be responsible to get someone else sick. So if you choose not to get vaccinated, what measures do you plan to take, if infected, to limit your risk to others? Now, how might you benefit? Most of us now have some immunity from prior vaccination and or infection. The current research indicates it continues to provide good protection from serious illness, hospitalization, or death on the order of 30 to 60%, in addition to whatever immunity one has. And this version of the vaccine covers the current variants. But what about the risk from the vaccine itself? Billions of people worldwide have been vaccinated, and the only safety signal that is borne out is myocarditis in young males. That's an inflammation of the heart that resolves in just about every case. Myocarditis from COVID, by the way, occurs 5 times more frequently and doesn't resolve so easily. And the incidence of this myocarditis after vaccination in young males has all but disappeared in the past 2 years. Beware now of those who claim vaccine side effects based only on VAERS, the Vaccine Adverse Events Reporting System. Understand VAERS is only a place to report. It takes further investigation to determine actual cause. Now, some people have more local responses to the mRNA vaccines, fever, headaches, tiredness, that resolves after a few days usually. If you are one of these people, consider the Novavax vaccine. It's made in a totally different way from mRNA vaccines and has a lower incidence of these side effects. So when you engage in individual-based decision-making with your healthcare professional, consider these benefits and risks in the context of your life, family, loved ones, community. The fewer of us who get COVID and the more of us who are careful not to infect others, the less suffering in the community. Now, pharmacies are gearing up to provide COVID vaccines. Call first to make sure of availability. And the health department will also have COVID vaccines on hand soon. And remember, it takes about 2 weeks for any vaccine to reach maximum effect. The best time to get vaccinated is just before the next wave. The summer wave is starting to wind down right now. The winter wave generally starts around November, December. And if you've been infected recently, wait around 6 months to get vaccinated for the best immune response. So be well and be careful, especially right now.